Good afternoon, everyone, and welcome to this special legal compliance session on pandemic preparedness for agencies. My name is Nihal, Samara. I'm the General Counsel and Legal Director here at the law firm Kaizen Synergy, and I'd like to welcome you all to today's session. Today's session was actually scheduled, as many of you are aware, some 2 or 3 weeks ago in looking to support agencies in their preparedness for future lockdowns, but also in the event that the third wave was moving through. As we are running this session, we have found out just in the last some 30 minutes or so that Victoria will be going into a 7-day lockdown as well. So we are going to change this webinar around slightly, where for those agencies from Victoria that have jumped in, we are going to cover off some really specific items as well too. And actually, when I say change the webinar around, just the order in some of the slides. So we are going to run some of the real practical solutions straight up front, and then give you some legal compliance theoretical information afterwards, where we normally do it the other way around as well. So that said, let's move on to today's session. As always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar and also recorded, we do pay our respects to the traditional owners accordingly. So today's agenda is to really look at what does your agency need to do ahead of things like lockdowns and also potential third waves. There is a real sense of, well, how much does our agency need to do? And what things do we actually need to put in place to make sure that if, like what we're seeing in literally Victoria today, our agency is ready to go. Now, our compliance works have spanned over the last 15 years, and a lot of agencies do use the Genba 360 dashboard to really support the works that they are doing. And we're going to actually see 2 of those agencies and what we've actually recommended that they do even as early as this morning, and then made contact with them this afternoon in terms of some of the measures that literally they're snapping into place as well. Now, essentially, if I can boil this down to a number of just key points that your agency should be looking at, these key points aren't about size of agencies. So it doesn't matter if you're a small agency of maybe 3 people or so, where the CEO is also the finance person, is also the cleaner, is also the receptionist, and you might have a couple of volunteers, right across to agencies that have a couple of thousand odd staff and the likes. So really, when we look at this, it's important that your agency has its COVID safe plans up to date and its reporting, QR registers, certainly from different state government entities around those as well too, cleaning registers and work health and safety requirements, as well as obviously things like informing your committees of management or boards. Now, also there are some HR and COVID vaccine rules that your agency should really be across around this. People also talk about HR registers and workplace COVID forms, and we're actually going to show you what these actually look like as well too, and that includes managing your HR and client record information management systems. Now, essentially, when we boil this down, we look at what we've suggested to agencies based in Victoria as of today that are going into lockdown at 11:59 p.m. today. We've actually said to look at ramping up your COVID safe plans. We'll look at what that looks like. Importantly, though, if I could really focus in on this, is that your agencies look at staff and volunteer screening forms. In some states, they have called this daily attestation forms, and the purpose of these forms is to ensure that your staff and volunteers essentially are COVID symptom free. It also means that you then, before they then go out and see clients, or if their clients are coming in and seeing them, that you complete these forms as part of this attestation. And it's basically like a statutory declaration. Think of it like that. The other part is working from home registers as well too. We'll see what those look like. And also, importantly, screening clients for symptoms. Now, this may depend if you're let's say, a religious group, a religious agency, ensuring that not only people just check in using QR codes and the likes, but also that you're actually screening clients to ask them, do you have any of the symptoms of COVID? What does that look like? If you are a community or health service as well, we actually take that one step further in actually ensuring that you screen clients and asking those questions on it at the very least. We know and we work with a lot of Aboriginal and community and mainstream community health services where they do have point of care testing on site, and where people may report symptoms, they're actually calling them in to actually have those screening tests done. Equally, HR registers and workplace COVID forms are equally important as well. Now, for Victoria agencies, and I'm going to jump straight in onto the dashboard for yourselves to make sure that you maximize this because time is of the essence for you. Now, essentially, just about an hour ago, the announcement was made by the Chief Medical Officer that Victoria will enter a 7-day lockdown from 11:59 p.m. tonight. There are currently 5 reasons to leave home. These are shopping for food, work, caregiving, exercise, and getting vaccinated. In addition, we are also recommending that agencies, and again, we say this, continue to have their that staff complete their daily assessment forms and provide staff with travel permits as required under the department in a few months ago as well too. That was done for the week's duration. And where health services, including community standalone Victorian community health services, Aboriginal medical services and the likes, continue to screen vulnerable members of their client groups and staff. Our law firm also supports aged care and positive aging services as well. And where those vulnerable members of the community in the past year have been subjected to a number of outbreaks, we actually have recommended that agencies take the additional step to what I'll call screen their clients that are under their care to ensure that they aren't exposing them or essentially are catching the symptoms as fast as possible. So and the reason that we list the last 3 points to you is to ensure that agencies from a compliance point of view meet their work health and safety obligations. That is the broader context of ensuring that staff and clients that you provide services to have a safe environment to actually receive services that you deliver. And also from that as well too, that you're meeting your obligations under the Public Health and Wellbeing Act as well too. So there are a number of pieces of legislation that we're actually suggesting that yourselves actually look at this as part of this process. Now, I am going to just pause this webinar slides right here and jump you in to the dashboard that a lot of agencies use. And we will come back directly to this, but specifically for our Victorian agencies that are joining us today. Now, I've said that there are a number of forms that your agencies should be using, and I will add that agencies, and when you log into your Genba Dashboard, for those of you that are joining us new today, you will get access to this as part of the resources as well. It'll ask you for your username and password, which will be sent out. When you log in, it will take you into your own screen and it will look something like this. Now, with this, this dashboard has been used by a number of agencies really since the start of this webinar. What does this look like when I say a number of things off? And I'll just jump back to ensuring that staff complete their daily assessment. We're going to look at also in terms of working from home forms, and also HR register forms as well. So let's just quickly go through this, because I want to make sure that the Victorian agencies that are joining us are really supported to make sure that they've got access to these, especially where there is a 7-day lockdown and staff may be working remotely as well. So essentially, Genba Dashboard is web-based. You can access it from any mobile device as well too, and also from desktops. Now, it gives you direct access to this. Essentially, the COVID daily assessment forms can be seen on the left-hand side. Here is an example of one here. Staff can go in and they're asked a series of questions. Now, the purpose of this has come from various departments of health and human services across the country. Essentially, it will be when people log in, it'll have their name, it'll have the date, and it'll have the time that they've actually logged in. The daily assessments form, think of it as like a statutory declaration that actually says, I agree that when I'm filling out this form, I've assessed myself as not having any COVID symptoms, and also that I've reviewed, if I click on this, the alerts as well too. So it'll actually connect you and your agency to the Department of Health and Human Services in your relevant state or territory, and actually confirm the outbreak sites. So, and this will be updated, like in Victoria, it's gone from, I think, a few sites, a handful of sites at the start of the week to some 60 sites at the end of this week already. So essentially, staff are required to go in and answer these questions. Things like, have they been in contact with a confirmed case? Have you visited any outbreak locations in the last 14 days? Have you undergone a COVID test in the last 14 days? So essentially, then it asks individually, have you had any of the past symptoms? And this is the COVID symptoms that since the start of this pandemic, we have actually seen. Now, once staff have actually completed this form, they can save this form itself here. And here it is. I'll just mark it no for here, and know that we have these items, okay? Now, once staff complete this, essentially it gets registered onto this register. And you can see that I've logged in as this person, Fred, and it has been registered that I have made this attestation form. And you can actually go in as the manager of this and verify it. So you've got this information at hand. And this is one of the key things that agencies have been using since the start of this pandemic. It's worked incredibly well, because essentially you're getting staff to screen themselves to make sure that before they start work, you've got verifications that they have it. Now, if they mark yes to one of these symptoms, so let's say, yes, I've got a sore throat, and yes, I've got body aches, etc., then they can actually add evidence, and you as the manager will get notified about this. So it's important that you in fact complete this, and you can actually ask them, and if they needed to isolate, then you can actually go in and add information in. So if that's the case, you can say, I am self-isolating for the next 14 days, okay, or something to that effect. But you've got this information on, and if I save this form, what you'll find is that any changes that we've got is also logged here. So you've got the audit log. So by staff doing this, you're actually meeting your work health and safety obligations. The other part that I will mention is the working from home form. Now, with this, obviously the state governments and territory governments and also Commonwealth from the start of this pandemic have said, look, if staff work from home, then you need to be able to support them and provide this in place. Now, what we do have is not only the working from home approval form, but also the task lists of what staff are actually working on. So when they're actually going in and doing this, what this gives you is the capacity to really just manage and support staff throughout this as well too. Importantly, once they complete it, they can also add information into it as part of this, and you'll see little folders that appear. So essentially, you've got this information here that's sitting within the dashboard that allows people to, in fact, cover this information. And for Victorian agencies, by miles, this has been some of the most important things that they have also been able to do. Now, the other parts that I will mention around this is from an HR management point of view as well. And then I'll briefly go back to the COVID dashboard and then back to the presentation slides. Now, for agencies, one of the other parts that we've seen is now that people are going into lockdown, they've turned around and said, well, we need to be able to update our staff information, mobile phone details, contact staff, all this sort of stuff as well too. So two things on this. One, we have the HR management button that is located right here. And when you click on that, what will come up is the HR management system. And with it, when we click on this, here it is here, it gives you people's profiles that they can add in. We've got the directory that we can then look. So that way, if staff wanted to get a hold of other people as well too, they can click on the directory, nice and simple, and you've got immediate contact numbers that people can view here as well. More importantly, if you needed to update next of kin details, some of the most simple stuff that we're seeing with agencies is that they need to be able to update emergency contact details. So let's say there was an outbreak or there was an issue with a site that your agency has. You need to be able yourselves to contact people. And if you don't have their updated contact details, then how do you do this? So essentially what you're able to do here is to also allow your own staff and volunteers to update their own emergency contact details. So if I wanted to put in, let's say, my wife's name on this, and I'll put in my wife's details, and I'll put in the mobile number, which I'll just use my own because there are a couple of thousand agencies joining us. And here it is here, and I can put this in. So here it is here, and I've now added that, and it's as simple as that. So you can see with this, what we've also got here is the capacity to add this information. Now, one of the other things that is being rolled out for agencies is the capacity to have your vaccination registers, and I will cover this as part of the presentation. When we have this, what you now need to look at is vaccination registers for staff. And there may well be things that people turn around and say, look, I don't want to actually have information added in. I want to make sure that vaccinations, I'm not choosing to have one. And here is a doctor's certificate for it. Okay. So in this case, I'm going to say Fred has sought medical practitioner advice and has been recommended not to take the let's say vaccination. All right, something simple like that. Now you can actually attach the medical report that's been provided, or if it was the case that you did actually have the vaccination register and vaccination form, confirmation, medical note as well. And you can then load that in as well. Now, if you wanted to, what you can do is also take a photo of it if you like, and also place that information in here. Now, I am just going to pick a random document for you to show you how this works and click on upload. Okay. And here it is here. So now I've got my vaccination for this particular staff member's notice, and I can actually go in and actually view this document if I want to. There are permission levels that you can set up. So either if people are being exempt from it, or that they've got a medical condition that doesn't allow them to have it, you've got this information here. So you can see from the dashboard some key areas that you're looking at. You've got your assessment forms for staff, and volunteers. You've got your assessment forms for working from home for also staff and work plans. You've got your HR space. What we've also got in here from the COVID safe plan is also the capacity to update your own COVID plans as well. Now, if I click on this, you can see we've already pre-built the COVID safe 1, step 2, step 3 plans, as well as if you run events as well. In this case, we've updated it for the COVID safe plans for the lockdown measures. And in this case, for Victorian agencies, they're ready to go. So where this comes in from a legal compliance point of view, quite simply, if there are any legal updates, then we update these for agencies for you and you are ready to go. So this is where we have seen this today for agencies as part of this. Now, those are the main parts when going into lockdown for Victorian agencies to step into. All of you that are joining us today will get access to the legal resources and dashboards as well. Now, going back to our presentation materials as well, how this comes out is that since February 2020, we've been running these COVID safe sessions every time there's been a legal change. And you can view our past webinars either on our website under our knowledge base, which is open to all agencies, or you can actually go directly to our YouTube channel and also look up Genba 360, and you've got access to all of the past webinars that you can see as well. Now, with it, what we have seen, and this is something that we actually mentioned over the last few months, that lockdowns are to be a part of the Australian way of life until essentially everyone or close to everyone is actually vaccinated. And this was something that was taken from the Australian Doctor magazine some months ago. And it is something that we have referred to over the past short while as well too. And essentially, we are seeing that today in Victoria. Now, with it, we are welcoming a number of agencies from around Australia. And when we look at this system that we're talking about and the legal compliance webinar essentially covers all kinds of agencies wherever you are joining us from and whatever your core business actually is. So whether you're a legal advocacy service, disability, NDIS provider, education provider, aid agency, mental health service, council networks and the likes, what we're talking about essentially covers your groups and can be used by your agency. So by attending this webinar, we're hopefully going to give you a list of resources that you can start using today. Our staff on our support desk will actually make contact with you this afternoon and more than happy to go through this one-on-one with yourselves to ensure that your agency is also supported. And we have done this for over 4,000 agencies over the past 12 months now. Now, as part of this, we hope that you get a better understanding of the COVID rules. We're going to look at the HR rules, what these are and how these work as well too, particularly now in reflection of the lockdown measures that are based in Victoria. And we've got some active case studies to show you of that. Also, we'll be sending you out some legal resources as well too, including these slides to help you prepare for any third wave that might be coming and how you actually do this as well. Now, a few housekeeping items before we jump back into this presentation and the legal webinar is that to let you know that this webinar is being recorded all the way up to the question and answer part of today's session. With that, we do open up the phone lines at the end of the session and more than happy to stay online and answer any questions that you might have. We will be switching off the recording at that stage and obviously to protect people's privacy. But if you are listening to this webinar after the live session, then by all means, please contact us directly on 1300 360 360 or email us at support@gemba360.com. You also do have my direct mobile number that we have made public, and it is available on Google and the likes, so you can contact me directly should you wish to do so. Now, just a very, very brief introduction, as we always do, because we are having so many agencies join us today. We have had an email just bounce in from question panel. So if you do have any questions, by all means, post them into the question panel and we will get to them as we go through today's session. We will be emailing out all of the information and making contact with you, each of you directly today. So over the last 12 months, we have onboarded over 4,000 companies to support them with their COVID safe plans as well. And with that, um, we have also received NAIDOC awards as well too from agencies like Aboriginal Community Health Services for supporting the work that they do some 7 years ago, and also being recognised at the Dubai International Emergency and Disaster Conference for the work that we have done in pandemics as well. A lot of our legal work is not just black and white law. It is around the things that I'm talking today with you about, where we actually show agencies how to actually use the law to make it easier for your agencies to operate their services. As I've mentioned to you, the Genba 360 platform, and you've seen this a bit live already, is something that we designed some 10 years ago to really just support agencies doing the work around compliance and quality services and make things a lot easier to run. It is mobile, and therefore you don't need any equipment, so to speak, to actually run it. You can use your own mobile device, whether it be iPhones or smart devices, to actually access it as well. And you will all get access to it today if you don't already. So with it, let's go through the registers and the likes. One of the things that we're going to cover off is what are the core areas that your agency needs to look at from a compliance point of view. So in the event your agency needs to go into lockdown, it's ready and can literally flip a switch, and it doesn't affect it has minimal effect on your agency. Now, what we suggest you do is to have your COVID safe plans in place. Obviously, contact tracing is important, but also things like your daily attendance registers, staff registers, and workplace cleaning registers as well. It's important that these be updated from time to time, and your boards of directors, management are also kept up to speed as well. And we'll be going through some of these registers today and what these actually look at for you. So essentially, I'm going to say a lot of the key principles, you would have seen this before, are around ensuring physical distancing, wearing face masks, practicing good hygiene, keeping records and acting quickly if workers become unwell, avoiding interactions in enclosed spaces, and also creating workforce bubbles. So what we have done here is essentially take apart an office, so to speak, or a workplace, and actually look at what are the core things that you should be having within your agency. And this doesn't matter what sort of size agency you're working from. As I said, whether it's a small religious service or if it's a large health service, essentially this flow chart and this diagram will give you what you need to actually have in terms of specific activities that are done to ensure that you're COVID safe around your workplace. Now, what we have also looked at is the relevant Department of Health and Human Services guidelines from different states and territories and brought these together in these slide markings. So we have actually pulled this information up. We have looked at areas like ensuring physical distancing, what you need to look at, wearing a face masks and when you should be having these. Obviously, there are some directives that will come from the relevant state or territory government, but essentially this gives you the guidelines of when to wear them and when essentially restrictions can be eased. Also, for things like practicing good hygiene, a lot of agencies will ask us, well, how do we know if we're doing enough? What do we need to do? Do we need to educate our workers? What are the key checklists that we have? Now, you will have seen some of the agencies like Safe Work have issued these, but this information tends to be all over the place, and agencies come to us and say, look, we're just really confused about what we need to do. So we've summarized these here for you. Equally, when we look at keeping records and acting quickly if workers or customers become unwell. So again, this is the stuff that I've summarized down into those forms. And with it, we found that this actually works incredibly well by having not only the QR codes in place, but also the assessment forms. The assessment forms is such an important tool that you can use within your agency. And I will stress it is actually really simple to use. So part of that, of ensuring that if workers become unwell, what does that actually look like? Well, when you log into your Genba dashboard, as I've mentioned, you can have a look at that. It's listed as COVID-19 daily assessment. And with that, if staff are actually going through and answering these questions, then you'll find that you'll be able to jump on things very, very quickly around it as well. And you can also validate and go back. So if staff fall sick for other reasons apart from COVID, it may well be that they've checked these off and said, well, we haven't had these symptoms for these times. Equally, if they have one or more of these symptoms, but there haven't been any of the outbreak locations, then again, you've got most of the checks and balances yourselves to know what's going on within your own business and within your own agency as well. Now, the other ones is around avoiding interactions in enclosed spaces and some of the requirements there, as well as talking about creating workforce bubbles for larger agencies and also separating things like communal areas. So you've got these guidelines that we've provided to you, as well as also when they talk of creating the COVID safe plans and agencies asking what these actually look like. Well, again, look, you've found that we've actually placed this within the disaster module. And essentially, if I go back, you'll essentially see that it is listed under projects, and you can actually go into part 1 and actually have a direct look at this as well. Now, the other part that I will add around this is that prior to Victoria's lockdown, we have seen an increased compliance and enforcement by relevant government departments on COVID marshals that are required to oversee specific activities within agencies, and also checks are being issued under public health and wellbeing laws, and also information that WorkSafe will continue compliance and enforcement action under the relevant occupational health and safety legislation as well. So with it, it is important that your agency does tend to look at these. We have seen that the COVID safe work plan is a major tool for your agencies. And when we talk of this, people say, well, what does one actually look like? We've seen information from the department, and a lot of agencies are just confused around, well, how much do we actually need to do? Really, look, the COVID safe stuff, it's new. What do we actually need to look at as part of this? So what we have come up with is just a process for yourselves to follow. I'll breeze through these slides because I really want to walk you through just some of the tools to make life easier for you. But essentially, we've looked at all the legislation under the Biosecurity Act, as well as you can see the checklist from Safe Work as well too on the left-hand side. Also looking at directives coming out of the Commonwealth government as well too, and also pandemic plans that are relevant to your state and territory. Once this is done, we've then given yourselves access to the self-assessment tools, which feed into your COVID safe plan. And from that's essentially gives you step 2, and then looks at the areas to identify improvement, and that feeds back into your COVID safe plan. So you can see that really we've given that as just an easy way to deal with it. It makes it really simple to actually access, and you can see on your Genba dashboard that essentially you've got the COVID safe plan. If we look at this, it's listed under the project section. If I open this up, under the documents area, you've also got your other resources as well too. So that might include, for example, if we have a look under the COVID-19 checklist and resources issued by Safe Work and the likes, here it is here. And agencies say that's great, but it's in a PDF document. So we've actually changed that into a form for you. And equally for agencies that are, depending on where you are based as well too, your relevant state department might have issued a worker's permit. Now, what that looks like for you, if I click on that little button, that brings up a Word document that you can use. And this is the example of one that's used in Victoria. And again, it's information that's there, so that way if the state governments impose a 5 kilometre radius on your agency, then you've got access to this information to actually use for it as well too. And you can see rapidly how that works for you. Now, a couple of rules that I wanted to cover off is around the COVID-19 vaccine and the workplace. Now, what is important for agencies is just clarifying workplace rights and obligations. So when we talk of third wave preparedness, agencies are asking, well, what are our workplace rights in terms of HR obligations and reporting, and what do you need to do and follow as part of this process? Well, there are limited circumstances where an employer may require their employees to be vaccinated. And what does this actually look like? Well, essentially, there are currently no laws in Australia that specifically enable employers to require their employees to be vaccinated against the coronavirus. There are, however, limited circumstances where an employer may require their employees to be vaccinated. And essentially, there are a number of key considerations that need to be followed. Some of these include whether there's an enterprise agreement or employment contract, but also what services you may be delivering as well too, that either put clients at risk or staff at risk as well too. So that includes services in the healthcare or even meat processing industry as well. And we've done a lot of work around this with agencies. If you go to Fair Work, you'll see this information here that I'm covering off. And sometimes Fair Work will actually put on their own website, look, go seek individual legal advice around things. So we can support yourselves in actually doing this. And I can see there's a few questions that are coming up in the question panel, just asking, can we have individual discussions? Absolutely, you can contact me directly on the mobile, and more than happy to do that. So essentially, you can provide lawful directions around this, where if an employee needs to be vaccinated, but what you need to look at is identifying people that may have close contact to some of the most vulnerable people in the community, for example, those in healthcare or aged care settings as well. I can see that, and thank you to Sharon, who's just asked the question, Victorian restrictions places on worship. Is there a 5-person limit for the broadcast team? Is work permits required? That's a really good question, Sharon, around it. Currently, there is the 5-kilometre radius that they have imposed at the moment around it. We have sent out legal updates as early as just on an hour, just before this webinar started, that actually just suggested that agencies do provide work permits for their staff. The reason being around this is that we've seen it in the past, and then is that people often will get questioned why they are outside that 5-kilometre radius. And for that reason, we have actually suggested that having that letter, that work permit available, will just provide that certainty to staff as well too, if they do get questioned, because we can often see that in some jurisdictions like Victoria, they have very quickly turned to infringement notices as a way of additionally managing non-compliance with that lockdown measures as well. So thank you for that question, and we encourage people to place questions in as we continue those. Now, what happens if an employee refuses to be vaccinated around this? There could be a legitimate reason for not being vaccinated. For example, an employee may have an existing medical condition, and for that reason, they may be exempt from actually having it. Now, it's important to note that even during lockdowns, stand downs themselves are unlikely to be an available option for employers if an employee refuses a direction to be vaccinated. And stand down of employees is only allowed in certain situations. And you need to be careful equally, especially now with lockdown measures and government grants and incentives and also supports may not be available. So with that, the ability to suspend employees without pay may also well come into fair work arrangements that are also in place. So you do need to consider employment agreements before standing down employees and also asking them to take leave without pay. Now, with that said, if an employee refuses to be vaccinated, you can ask them to provide evidence about why they've refused it as well too. And as I showed you, that can be loaded back into the HR space as well. Now, if an employee refuses to attend the workplace because a co-worker isn't vaccinated, there isn't really any grounds for that action to occur. So essentially, because vaccination is not mandatory and most workplaces won't be able to require the employees to be vaccinated, the co-worker may have a legitimate reason not to be vaccinated. So for that reason, that isn't really an option for staff not to show up either. So essentially, as I move through this, the disciplinary action really comes back to individual circumstances and things that you must carefully consider. It also means that if you provide a direction for someone to be vaccinated, you need to ensure that you don't breach any anti-discrimination laws as well too. And also that includes things like whether the person has a disability, they're pregnant, or due to religious beliefs as well too. But in saying that, if you are recruiting and you may be able to require a prospective employee to be vaccinated before they start work as well too. So there are options there. Now, two of the agencies I just wanted to speak about today, one was Rumballara Aboriginal Cooperative, and I thank Laurie Seville out there, the Chief Operating Officer, who has given us permission to sort of talk about their agency. And this has been something that we've been doing over the past few months. And also Women's Housing Limited. And I acknowledge Judy Line, the Chief Executive Officer out there, and also Lindy Parker, the Chief Operating Officer, as well as Lena Tompkinson, the Compliance and Executive Officer as well. Now, with these two agencies, Rumballara is a large Aboriginal cooperative agency, some 200 or 300 odd staff providing services across aged care, health and wellbeing, medical services, housing services, and a broad range of other community programs as well. Women's Housing provides support services to men and women, especially supporting their services. And they've got about 30 staff that they work with. Now, with it, QR codes has been something that you need to ensure that your agency has in place as well too, where required, and often these are provided through the state government area. One of the things I will refer back to is the daily attestation reports. And this is something that has come out of this. It's important to not only have the check-ins, but also have the daily attestations for staff and clients. Now, some agencies have continued to use the event and workplace attendance registers. And again, from a third wave point of view, it's important that you have these systems in place. Now, with it, there are some agencies, and this is the work that we have done also with Sonia Evans out of Creation Ministries International, and acknowledgement to the great work that Sonia does at CMI as well. And one of the things that they've used is an attendance registers for their volunteers in different state and territories, simply because people that attend don't really use mobile phones, and QR coding and all this sort of stuff is all very, I want to say, space age, so to speak. So with it, it's a barrier for them to actually have it. So with it, they continue to use the attendance registers. So let's take a look at real life case studies here around this. I've mentioned around checking in and also the tools that you have on here. It's important that your staff and volunteers continue to use as part of this and manage your preparedness for third waves. And it's something that you can ramp up very quickly. Things like COVID assessment forms, workstation registers, working from home forms are all here and available on your Gemba system as part of this process. If we go back and actually have a look, and that was, let me just move back through the slides here. That's where we just saw things like women's housing runs through the same process. And if moving forwards, essentially looking at Rumbalara, they do exactly the same thing, but at a different scale. So it doesn't matter what size agency you're working at, the things that I'm talking about from processes need to be in place for your agency to be able to ramp up in the event that a third wave occurs, like what we're seeing in Victoria today, where lockdown measures are occurring. So they've got access to their COVID safe plans, they've got access to policy, they've got access to their pandemic forms and HR registers. And this is essentially the same dashboard that I'm showing you across the other parts of the system when I say you can log in and actually access your own dashboard like it is here. So essentially by doing this, this is something that is true, tried and tested in its works. It also means that you can access your policy registers very quickly. And essentially what's important here is involve all staff, volunteers, and even members of your community into this. So with it, it gives you that direct source to be able to manage this. Now let's have a look at what it does look like as part of this dashboard process and how it works. So essentially, where we go into it, you will get a login detail. It will take you to this login screen here. You can also access it via our website. Now, we've just had a couple of questions on this around, is this a shared dashboard? No, it's not. We set this up for each individual agency. So if you're coming, let's say Rumbalara as an example, has a separate access to all staff and all volunteers at other agencies like Women's Housing Limited. By logging in, essentially you get taken to this blue button and you log in to your own dashboard. You've got access to your COVID assessment forms, which you can see on the left-hand side. These daily assessment forms allow you to actually screen your staff very quickly. It asks the core questions that you need to follow as part of your process. It means that you can very quickly monitor staff and see if they've got any symptoms and if, importantly, if they don't. Now we've got outreach workers and support workers that provide also nursing services as well too. They all use these forms as part of it, and they've found it incredibly effective to manage their process. Equally, you've got your disaster systems to allow your COVID safe plans as well. So when we look at this for your agency, we suggest that you look at this. We suggest as part of the third wave preparations, you review your COVID safe policies, your HR registers, and ensure that you've got these systems in place to ramp things up very quickly if needed. Next week, we will be looking at broader HR applications for you. If you do have any questions, then please contact us directly on 1300 360 360, or you can email us at support@gemba360.com. My mobile number is also listed here as well, and we will be posting this to the group as well. Shortly, we will be opening up the phone lines and staying online to answer any questions that people might have. If you are listening to this recording after today's session, then please contact us on 1300 360 360 or email us at support@gemba360.com.